Anterior neck flexor training is a key part of a physical therapy program, both in the clinic and out of the clinic. So it's really imperative that as physical therapists, we not only understand how to train the patient to do this at home, but also that we as clinicians know exactly what we're looking for while we're training the patient to strengthen the anterior neck flexors. So typically there's a lot of weakness in the longus colli, the longus capitis, these deep anterior neck musculature that actually attach to your spine, which are your stabilizing musculature for the whole cervical column. So first thing we want to look for is proper cervical movement. So we're really just trying to focus on the upper part of the cervical spine. So no lower cervical spine flexion extension, only upper cervical spine. So the way I like to do that is take my fingers and just palpate the upper cervical spine, spinous processes, and then have the patient double chin and just retract into my fingers. So they have that biofeedback on pressing their spine into my fingers. And relax. So Alana, what I want you to do is just do that a couple times, back and forth. Retracting, feeling that pressure on your spine, and relax. Good. Try to hold for a little bit longer. Good. Hold for a second. Relax. Hold, and relax. Now let's go for about a 5-second hold. Good. So now we're doing some more sustained contractions, training her to hold those anterior neck flexors tight. Keep that chin down. Good. When we're ready to transition the patient to a home program, we want to utilize a small towel roll, and that'll allow for some biofeedback instead of utilizing my fingers on the spinous process. So I'm going to take the towel roll and just put it in the little lordosis of her neck here. Okay? So we have that little pressure feedback. And again, Alana, what I want you to do is just double chin, flex that upper cervical spine, feel the pressure on the towel roll, and relax. And again, good. I want you to hold that for about 5 seconds and relax. So we can do short isometrics of 5 seconds, and we can progress this to 10 seconds, 20 seconds, and so forth for her home program. And this is a stage 1 anterior neck flexor training exercise with the towel roll. When we want to progress this to a little bit more difficult, we can start doing concentric and eccentric anterior neck flexor lifts. And what we do by the way we do these is we have her retract. Okay, so that double chin, that upper cervical flexion, contracting the longus colli and longus capitis. This time I want her to keep that chin tucked and gently nod up. Okay, and here what I'm doing is actually palpating the SCM here. We want to make sure that that doesn't fire and come back down slow. Okay, so we want to make sure that we're not having these bulging sternocleidomastoid muscles here. We want to work on these deep anterior neck flexors. So we can palpate in there, double chin again, nod up. Good, and slowly down. Okay, let's go one more time. Double chin, nod up. Good, a little higher, and slowly down. You can see on that one we had a slight protraction of the neck, so we want to really cue her to be careful of that. Okay, when we want to progress her to stage 3 here, we can do sustained holds, isometrics. So we're doing that retraction again, that nod. Okay, there we go, keeping that upper cervical flexion and just holding there. So I'm going to remove my hands, watching to make sure that that neck does not protract and go into upper cervical extension. We keep that upper cervical flexion right there, making sure the SCMs are not firing too much, and slowly down. So you can progress 5-second holds, 10-second holds, and so forth as the patient progresses with their stability training.